you know that not taking care of your oral health can make you 2 to 3 times more likely to develop a cardiovascular disease? Numerous studies have shown that there is a link between poor oral health and higher rates of heart disease. If you are someone that thinks this doesn't apply to you and that brushing gets the job done, then it's time to brush up on some facts. According to the American Dental Association, you are still at risk for developing gum disease if you are not flossing and just brushing. Not flossing leads to increased risk of gum disease and also bad breath. Not flossing can lead to gingivitis, which can progress into periodontitis, which can then lead to bone and tooth loss. I think it's safe to assume that many people are unaware that poor oral health can lead to cardiovascular issues. Within the last 2 years, I made the commitment to start flossing every single night, and I have noticed a huge difference. I'm someone that's really prone to having cavities. I got them even with brushing twice a day and flossing occasionally. I still got cavities until I started flossing every single night, and since then I have not had any cavities. I have also done research to help inspire people to take their oral health seriously and to prevent gum disease. Today, I will offer you a solution to help decrease the risk of cavities, gum disease, and heart disease. First, I will discuss the problems that come from not flossing. Next, I will propose a solution to decrease the risks of developing cavities, gum disease, and heart disease. And finally, I will show you that incorporating my solution will have many benefits and will improve your life. Now that we have learned a little bit about this topic, let's discuss the problem. The problem is that people are not flossing, and that can lead to various oral and heart issues. According to US News, only 30% of the population flosses daily, 37% less than daily, and 32% never floss. Gingivitis, which is an early form of gum disease, is very common in young adults, and many people have had it without even knowing, but because luckily it is reversible, and flossing is something that can prevent and reverse gingivitis. Many people claim that they are too busy or flossing is too time consuming, but it really only takes 1 to 2 minutes. And taking those minutes can save you from many health issues as well as save you money. Not flossing can lead to cavities and gingivitis, and according to Premier Periodontics, when gingivitis is left untreated, it can progress to periodontitis. And as gum disease progresses, the chance of heart disease also increases. According to Harvard Health, there are a few explanations for the link between oral and heart health. The main explanation is that as bacteria infects your gums, it can travel through your blood vessels into your body and can lead to blood clots, which can lead to heart attack or a stroke. Another reason it's important to floss is to prevent cavities and tooth loss. According to GoodRx, one cavity filling can cost up to $1,150. And if tooth decay goes left untreated, that can lead to having it pulled or having a root canal. The problem of not flossing is something more than half of you reported in my survey. When you were asked if you floss daily, about 54% of you said no. Half of you reported the reason is that you're too busy, and the other half reported that it's too time consuming. You aren't alone. These are the 2 main reasons that people report for not flossing. Majority of you also reported that you have had many cavities in your life. Only 2 of you have said that you have had none. And 77% of you reported that your dentist or hygienist has suggested that you floss more. Now that we address the problem that many can relate to and issues that arise, let's look at what we can do to incorporate the solution. Many feel that there's no need for flossing and that brushing is enough, but brushing really only removes the plaque from the front and the back of your tooth. Flossing removes the plaque and bacteria from in between your teeth and like up into your gums. So it's pretty obvious that the best solution is to commit to flossing at least once a day. Flossing daily is simple and does not have to be this huge chore, especially once you develop it into a habit. In a perfect world, you really should be brushing and flossing after every single meal that you eat, but we all know that that's not really realistic. So that's why it's recommended to brush twice and floss at least once. And if you can only floss once, do it at night, because that's when the bacteria just sits in your mouth all night and your chances of getting gingivitis or cavities are way higher. Flossing properly is effective to remove the plaque and bacteria from places that your toothbrush missed, and it's important to brush for 2 minutes and then floss or use a water pick to remove bacteria that can lead to oral health issues. Flossing is a good way to reduce bad breath as well, because leftover food left in your teeth can lead to decay, which can lead to bad breath. Flossing saves money and it can boost your self-esteem, because when you have better looking teeth and better looking breath, it can make you feel more confident. Many of you answered that flossing is too time consuming, and this is just not a great reason for not flossing, and I will show you why in 2 ways. First, I will use minor repair to show that flossing is not as time consuming as it seems. When it's done correctly, it should really only take about 1 to 2 minutes. And the proper technique is to slide the floss in between your teeth and make a C shape in your gums. And that makes it, and once you master that, it makes it way more quick and efficient. You can also use a water flosser. Those are a good alternative if you don't like the string floss. It works just as well. It might even be quicker. And then also, if you don't floss because your gums bleed, sorry to say, that means you need to floss more, and eventually your gums will stop bleeding the more you floss. According to Westchester Dental Arts, there are some ways to motivate you to incorporate flossing. The first one is you can set an alarm on your phone or leave a little note in your bathroom or wherever to remind you. Second is leave your floss somewhere in your eyesight in your bathroom to also remind you. Third is to really try and incorporate it into a routine, whether that's your morning or your night routine, preferably your night one. And then lastly, you can try and take the 21-day challenge, because on average, it takes about 21 days to either make or break a habit. And so if you challenge yourself to 21 days of flossing every single night, you're more likely to develop it into a habit. Next, I will expose the dilemma that we either make the commitment or suffer the potential consequences, which are bad breath, tooth loss, gum disease, and heart disease. Your teeth that you have now are the teeth that you're going to have the rest of your life. So it's really important to take care of them. And studies show that majority of adults do not floss, even if their dentist is telling them to, and your dentist is telling you to for a reason. Not flossing can lead to plaque buildup, which can lead to gingivitis. This can lead to increased risk of cardiovascular disease. And although the connection is still not quite fully understood, there have been numerous studies that show that there is a link between people with bad oral health and heart disease. It's very possible to make the time to floss only 1 to 2 minutes. There are different ways to motivate yourself, and learning the risks like we did today is a good way to push yourself to make the change. So now that it's clear that flossing daily is an effective solution to prevent tooth decay, gum disease, heart disease, let's visualize what life will look like. So take a minute, imagine what life would look like if you don't start flossing and don't take care of your oral health. You have bad oral hygiene that can lead to bad breath, which can lead to people not wanting to be around you, which can make life pretty lonely. You also end up spending hundreds, if not thousands of dollars on dental work, even more if you don't have insurance. Eventually, if you don't take care of them, you can lose your teeth, which can lead to dentures. And then you also have to worry about your increased risk of developing heart disease. Now imagine life if you do incorporate flossing. Imagine your future, you have a radiant, beautiful smile, lights up a room, and your breath smells great. And as you age, your teeth stay in good condition, so you don't have to pay to get them extracted or get implants or dentures or fillings or root canals. And lastly, you will have now lowered your risk of developing heart disease caused by oral health. Today, I have explained that you should floss your teeth at least once a day to improve oral health, prevent cavities, gum disease, and heart disease. First, I discussed problems that come from not flossing. Next, I talked about how flossing significantly decreases your chances of developing gum disease, cavities, and lowers the chance of heart disease. Lastly, I discussed 2 different outcomes that compared what life would look like if you floss versus if you don't floss. So make the commitment to yourself, to your health, and to your future. Floss each night before bed, and embrace my suggestions to keep you motivated. Set an alarm, leave a note in your bathroom, and make sure that you are using the right technique to floss. I hope everyone decides to take the journey to healthier teeth, healthier gums, and healthier hearts.